Okay, welcome everyone. I'd like to wish everyone a very warm welcome for this afternoon session. We're really pleased to be here to be able to share some of the ongoing work around the measurement of diets in school meals and among school-age children. We've got a really great panel to join us today to talk about some of the different work that's ongoing. I'm going to just do a short introduction of colleagues, and then I'm going to turn it over and we'll start the discussion. We'll go through a short series of presentations, and then we'll have some time for Q&A. So I'm joined today by Aulu Jelly. He's with IFPRI. We also are fortunate to have a video recording from Melissa Varga, who works with FAO. Winnie Bell is also joining us from the Intake Project. We have Gloria Fulston, who's coming to us from Ghana University, as well as Arlene Mitchell, who's joining us from the GCNF. We're looking forward to hearing the latest work that's ongoing around the measurement of diets among this age group. So I'm turning it right over to Alu. He'll kind of give an overview of the topic and some of the work of IFPRI. Over to you, Alu.
Wonderful. Thank you very much, Linda. Good morning, good afternoon, good evening. Let me just quickly share my screen. So over the next 7 minutes, I'll be talking to you about school feeding, diets, and nutrition, and really trying to help frame where these linkages are and how important it is to understand them, to identify entry points for interventions to make the programs more effective. So why is this important? Recent estimates on the global burden of disease suggest that dietary-related risk factors contribute to about approximately 20% of global deaths, about 11 million deaths a year. This is partly due to the shifts towards increased consumption of unhealthy foods, coupled with reductions in physical activity that have contributed to increases in rates of overweight and obesity. We know about the micronutrient deficiencies that impair children's growth and development. But in this context, school age and adolescent nutrition has largely been overlooked in terms of global nutrition targets. But school feeding programs can provide important direct contributions to daily food intake for school-age children, both in terms of the macronutrients and the essential micronutrients. But they can also provide a platform to improve food choices and diet-related behaviors more generally. However, despite the large-scale investment in school feeding globally, we have limited data on the quality of meals, diets, and nutritional status in school-age children. Moreover, as we've heard from some of the previous sessions, evidence on the effects of school feeding on diets and food-related behaviors is also limited. Moreover, we also have a gap in terms of the methods and the measurement of indicators or data on diets and nutrition in school-age children. This framework here kind of highlights from a systems perspective all the different entry points and all the different factors that end up shaping what a child eats. So these factors are at the child level individually, then they involve the household and the caregivers and all the different dynamics that are happening within a household. These in turn are influenced by a range of factors, including the personal food environment, including accessibility, affordability, and convenience of foods, the external food environments, including retail and commercial markets, but importantly for school-age kids, the schools and school feeding programs themselves, as well as the broader supply chains that essentially comprise the whole food system that interacts to shape what children are eating. And the links between school feeding, children's diets, and nutrition pass through some of these processes. But improving children's diet is a key result towards improving nutrition. However, food intake actually depends what happens in school, at home, and in the surrounding environment. But what do we mean by a healthy diet and how do we measure it? Currently, there's actually no consensus or constructs on metrics for a healthy diet or diet quality. And all the existing metrics have pros and cons. Some of the constructs that are of interest include the adequacy of intake of essential micronutrients. We're essentially comparing a level of intake with some requirements for a healthy living, healthy life, or those food patterns that are aligned with better health, so like consumption of unhealthy foods or consumption of fruits and vegetables, for example, leading to short-term better health, or food consumption patterns that offer protection against diet-related non-communicable diseases like overweight and obesity and their consequences. But increasingly, there's been an interest in also trying to incorporate, human health with planetary health, really realizing really part of a system and really trying to incorporate both elements in terms of the impact of food on the environment is also important. And this is an area of ongoing activity, and we'll hear more about a very interesting indicator called the Global Diet Quality Score from a presentation later on. Measuring diets is actually quite complicated, though, and we have some methods that have been validated in certain age groups, but there's a bit of a validation gap in terms of tools for school-age kids, and this is partly due with the task being difficult and the age at which kids can accurately self-report what they've eaten without caregiver assistance is not very clear. So these methods rely on recall, but who do you ask? You ask the parent, you ask the child, you probably need to ask both, depending on the age of the child, right? And the primary school age group is very broad. Like in the context of Ghana, we have children who are 5 and children who are 15 in primary schools. So of course, the way you interact with a 5-year-old is very different from the way you interact with a 15-year-old. And their choices are also going to be very different in terms of how they source their food. So the recall methods need to be tailored to the different specific types of respondents. This slide is complicated, but it kind of highlights the links between program delivery, program design, and program delivery for school feeding, and the results you'd want to achieve in terms of impact. And in green, we've highlighted the boxes that rely on program design and school meal quality as a key pathway to link to improved diets. And unfortunately, this is where there are some important data gaps that are critical to the way programs are functioning. And in particular, one gap that we're going to focus on in this session is around the quality of program implementation, which is key to ensure that school feeding can contribute meaningfully to improving children's diets. And a key step in this process involves setting standards for the school feeding service provision, including standards for the quality of the meals or the food transfers that are being provided. And standards provide the basis for the meal planning, the food procurement, the implementation, and the M&E. So we blew up essentially those boxes that relate to the food standards and highlighting some of the key steps, including meal planning, that provide the anchor for some of these different processes that lead to the delivery of a quality school feeding program. And in the next session, we'll try and unpack some of these steps in more detail, particularly because we have important data and evidence gaps that really remain on the quality of school feeding program implementation and the contribution of school feeding to improving children's diets. So the next presentations will focus on firstly on the role of food and nutrition standards for school feeding in improving meal quality and influencing diets from Melissa Vargas at FAO. We'll then have a presentation on an overview of a new indicator, the Global Diet Quality Score of Meal, Gdqs meal, designed to measure the quality of school meals by Winnie Bell at Intake. We'll then have a practical example of a validation study involving new technology using computer vision to assess diets in school-age kids from Gloria Fulston at the University of Ghana. And then lastly, we'll have a snapshot of the latest data on school meal quality and nutrition from GCNF's Global Survey of School Meal Programs with Arlene Mitchell. But I'll leave it at that. Thank you very much. Over to you, Lily.
Great. Thanks so much, Alu. Really great to get the overview and to set us off in the right direction. I'm going to turn it over now to Ank, if you can start the video. Unfortunately, Melissa can't join us live, but she's prepared a video. Thanks.
Thank you so much for the invitation to be able to speak during this important event. On behalf of FAO, we are very happy to talk today about the need for nutrition guidelines and standards and our joint work with WFP to support governments in integrating them into their school meal programs. Building up on my colleague Aulu's presentation, there is evidence that wide variations in the food composition of school meals and on children's baseline nutrition status explains or accounts for some of the variability found in the effects of school meal programs on diet quality and nutrition outcomes. There is also evidence that robust design of nutrition guidelines and standards and their implementation with fidelity within school meal programs can indeed improve the quality and adequacy of the meals that are provided to children and adolescents. But not only this, they can also ensure that children are entitled to the same benefits in terms of nutrition quality, especially in programs that are widely decentralized or that have a lot of regional variations. But before we go into what it takes to develop these robust nutrition guidelines and standards, I would like to present the definition that we have adopted in order to avoid the confusion on what they delimit or they are. So we define them as a set of rules, principles, and recommendations based on sound nutrition science and the national and local situations that are designed to improve nutrition quality, quantity, and adequacy of the foods and meals that are provided in schools to children. Guidelines we refer to mostly as recommendations, and standards as specific values and quantities, level, or frequencies, and that they are often compulsory or even mandated by law. But this is, of course, not the case in all countries. And we found this variation in a 2019 inquiry that we did globally. In fact, the legal status of nutrition guidelines and standards is an area that we're currently working on and trying to understand its potential and its implications. Having established that nutrition guidelines and standards for school meals are critical to strengthen the programmatic impact pathway to improve diets and ultimately nutrition, we know that most countries do have some criteria that guide what the meals should contain. So in this global process that I mentioned from 2019, we have seen that these criteria vary widely between countries, from simple food-based recommendations for a couple food groups to minimum quantities of a few commodities to very complicated set of rules for daily and weekly frequencies, for instance. And then when we ask those that had well-defined nutrition guidelines and standards what their main challenges for adequate implementation were, we found that in the beginning, there is, even for design of such standards, there is no clarity upon what is the best process to follow or internationally recognized methodology to do so. For instance, on what data should be considered and how to base the decisions on nutrient or food-based targets. As well as there is a quite narrow development that sometimes only health stakeholders are involved in their development. In terms of implementation challenges, and I don't have time to go through all of them, but we have seen that there are mainly challenges of procurement and supply, infrastructure and equipment at school level, also following preparation and serving processes when the guidelines mention beyond the composition, but also on the preparation and the serving, the capacities and the human resources that are needed to ensure that they are implemented with fidelity, as well as monitoring their compliance and measuring their impact, as Aulo was mentioning, and of course, as we will be talking in this event today. So in response to these challenges, FAO and WFP devised a project which main aim is to design a global methodology to be able to support countries in exactly what kind of data should be assessed, how to ensure context-specific decisions, how to justify the different decisions, what to do in terms of lack of data or poor quality data, and what aspects too are really affecting the dietary issues of the children, and how to integrate them in the nutrition guidelines and standards beyond only the meal composition. We are also pilot testing issues to understand how user-friendly it is, if it's adequate for different countries on their wide variety of contexts and limitations of data. Also, we are going to set a couple of studies to understand their dietary effects of the resulting nutrition guidelines and standards from this methodology in 2 countries, in Cambodia and Ghana. We're also developing guidance on several aspects that we have identified that are critical for adequate implementation, from what type of food and nutrition education should be complementing the implementation of the standards, to the coherence with other food environment policies in the school, how to understand and identify the need for a capacity development throughout the system, the harmonization with the procurement guidelines, as well as how to integrate them into legal and policy frameworks. So the methodology itself is aiming to have step-by-step guidance to be easily followed, and it should be an evidence-informed, food system-based, phased, and iterative approach. And we are basing it on the school food system because this is what really determines their feasibility and their actual implementation. I'm trying to understand what is possible and then consider this and see the best way that we can achieve those standards, those minimum standards. And the aim, of course, is to have context-specific, feasible, and flexible nutrition guidelines and standards. I don't have time, unfortunately, to go through all of these, but this is basically a snapshot of what it will look like, of the steps that they will involve. And I will be more than happy to respond any questions. I will leave you my contact, and basically, we hope that this methodology is available by the mid-2023, that we have already revised and piloted, and that it should be quite comprehensive in order to allow different governments to use it without any support. I leave you with my contact and also with the page of the project where you can find all the information that you need. Thank you so much.
Great. So that was a fantastic virtual presentation from Melissa. Thank you, Anne, for sharing that. I'm going to turn it now over to Winnie Bell from the Intake Project. Winnie, over to you.
Great. Thank you so much, Linda. Let me just get these set up. Okay, hopefully everyone is seeing the presentation mode. Super. So as Linda just said, my name is Winnie Bell. I'm a senior technical advisor with Intake Center for Dietary Assessment, and I'm presenting today joint work that we're carrying out with the Rockefeller Foundation. So the framing from Aulo and also from Melissa just now are really helpful in kind of preparing for this presentation, which is related to a new metric for measuring meals. The origin of this and the starting point for this work is really coming from the power of procurement for nutrition initiative, which is a partnership between Rockefeller Foundation and the World Food Program. And the central approach for this work is to really focus on how diets can be improved through leveraging institutional procurement in order to deliver healthier meals in a budget neutral way. And the intended outcomes of this work would be to enable governments to provide healthier diets to vulnerable populations without increasing budgets, and also contributing to healthier overall dietary patterns and ensuring that suppliers have a stable market. However, in order to improve the procurement practices for healthier institutional feeding options and ultimately for improved quality of meals and menus, a standardized metric is needed. And as Aulo noted earlier, this is something that, particularly as it relates to meals and menus, has been lacking. Plus, it's a complex, there's a complex array of considerations when thinking about what are the qualities of an appropriate metric. So we set out to kind of design and propose a potential metric for measuring meals and menus in institutional feeding contexts. And some of the preliminary design principles that we collectively came up with are listed here, including that the metric itself should be appropriate for use in different contexts and should also be universally interpretable. It should be comprehensive in that it's able to measure both nutrient inadequacy and diet-related non-communicable diseases. It should be responsive and sensitive in that it should allow for capturing changes, small changes in meals and menus. Should be something that's simple and easily understood by policymakers and other stakeholders, such as teachers, parents, and students. It should be able to be integrated into a continuum, so looking from meals to menus and all the way through diets. It will ideally also be low cost and have a low time burden for users, which we know is important in the context that we work, and then also obviously be valid and allow, that it's been validated in a rigorous and validated and tested throughout. So these sort of foundational principles for this work are building on the Global Diet Quality Score, which is a diet quality metric that was released about a year ago and has these attributes in place already. So it was developed by Intake, the Harvard School of Public Health, and then National Public Health Institute in Mexico. It's been validated for both nutrient adequacy and diet-related non-communicable diseases in non-pregnant, non-lactating women, and has been validated using 14 different secondary data sets across 14 countries, spanning low, middle, and high-income populations, high-income countries. And it's currently being validated for children 2 to 14 years. The way the Gdqs works, just at a very high level, if you aren't familiar with it already, is that individual foods are classified into 25 different food groups, into one of 25 different food groups that are considered, as you can see here, either healthy, unhealthy, or unhealthy when consumed in excessive quantities. And each food group has a specific threshold of grams associated with it, and points are awarded accordingly. And the objective is to basically have as high a score as possible, which correlates to a healthier diet and healthier outcomes. So the Gdqs meal metric, which I'm introducing, builds on these principles of the Gdqs, of the original Gdqs. So one major notable difference, of course, between the Gdqs meal metric and the original Gdqs is that we are measuring the food that's being prepared and served to students for a single meal or throughout the week for a menu, whereas the Gdqs is based on a respondent's recall of what is consumed in the previous 24 hours. This difference allows us to make some various modifications that I think are notable. So a couple of things to just flag here. One is that the current Gdqs thresholds will be adjusted for the Gdqs meal to allow for consideration of various age groups based on the child validation work. And another notable change is that we will be using a linearized scoring method rather than hard cutoffs. And this is because we recognize that smaller quantities of each food are being served in a given meal, and therefore we want to be able to provide a fraction of a point to recognize that. There are some additional adaptations that we'll be making and that are already underway, and this includes that we are adding modules that award additional points if foods that are served are biofortified or have post-harvest fortification. This is possible since, again, we're collecting information on the meal and menu served rather than on self-reported information wherein individuals may not know if the food itself is biofortified or fortified. In addition, we're developing in addition to the Gdqs meal metric, we're developing a metric that will measure menus. So this is designed to reflect 5 days of meals, basically. And within the Gdqs menu metric, as we're referring to it, this will also include a dietary diversity module to account for the daily diversity across food groups and food items. So both this Gdqs meal and the Gdqs menu metrics will be scaled and expressed as a score from 0 to 100. In terms of ongoing work, there are several things that are actively being pursued right now and within the next year will be carried out. This includes validating some assumptions related to plate waste in different contexts, also expanding the diet quality metric itself to include measures for environmental impacts of the meal and menu. This is something that Aulo also flagged. We see a lot of potential for additional application in other institutional feeding settings, such as hospitals and dining halls with kind of buffet style arrangements. We'll be piloting this metric in up to 5 countries in partnership with the World Food Program. And ultimately, we aim to also develop a simple Gdqs meal and menu app to help expedite the collection of these data. And this is just a screenshot of the existing Gdqs app, which has already been designed for the central Gdqs itself. So just wrapping up, as far as our future vision for this work, we hope to and aim to scale up adoption across a range of institutional feeding settings. We foresee frequent either monthly or seasonal data collection in a wide range of contexts across different countries. We will be developing a series of advocacy tools and a data dashboard to display this information. And with time and testing, hope for this to become the go-to metric for assessing meal and menu quality and motivating positive change. So look forward to your questions and comments, and that's all from me.
Great. Thanks a lot, Winnie. Really fantastic to see how much work has gone forward and taken place with the indicator. Just to remind everyone that they can put their questions in the Q&A. So if you have questions for any of the speakers, please just go ahead and put your questions. We've left a little bit of time at the end, so we'll be happy to field those questions when we're finished with 2 more speakers. So now I'm going to turn it over to Gloria Fulston from the University of Ghana. Gloria, very good, great, thanks. Over to you.
Right, thank you, Linda. So I'm presenting on behalf of the Nudging for Good team, led by Dr. Aulo Jelly, and I'm presenting work we did to validate Franny, which is our AI-assisted dietary assessment tool against weight records and 24-hour recall. Next slide, please, Aulo. All right, so in previous work that we did, we found that Franny could accurately assess nutrient intake in Vietnam and Ghana as accurately as 24-hour recall in adolescent girls. So we wanted to find out if we could use Franny, or how Franny would fare in primary school age children, who form 14% of the Ghanaian population. Next slide, please. All right, so this is how Franny works. You take a picture with your food, and then the AI recognizes the food based on different colored pixels and tries to estimate the quantity of the food with the help of a visual prop, which in our case is always a yellow colored pop socket placed by the food, the plate. Next slide, please. Okay, so the aim of our study was to validate the use of a mobile phone AI-based technology, which we've called Franny, which is Food Recognition and Nudging Insights for short, in primary school age children, against the weighed records gold standard method and the 24-hour recall method. So our objectives were to estimate food nutrient and adequacy of micronutrient intake using the 3 methods, and to assess the extent of agreement with Franny with weighed records and the 24-hour recall method, and also to examine sources of error for Franny and the 24-hour method. Next slide, please, Aulo. So the study setting was urban communities in Accra, Ghana. Our sample was 60 school-age children between 9 and 15 years, sampled purposively. And we did dietary intake assessments on 2 non-consecutive weekdays using all 3 methods. Next slide, please. So this was the sequence of data collection. We would train the children to use the app on the first day, and on the second day we would have the weighed records at the same time the kids would use the Franny app, and then the next day another team would go and do the 24-hour recall, and then the next day we would have the same another round of Franny and weighed records data collection, followed by the 24-hour recall, and so on and so forth. Next slide, please, Aulo. Okay, so these pie charts show where the food the children consumed came from and where they consumed the food. So in all, we had 1,269 food consumption episodes over a 120 person day period. And we can see that about a third of these meals were home prepared, and a little more than half were actually purchased ready to eat foods. And looking at where they consumed these foods, almost half, but not quite, were consumed at home, and a little more than half were consumed at school. So there's quite a bit of food going in at school. Next slide, Aula, please. Okay, so next we tested the equivalence. We did equivalent testing. That's looking at ratios of the daily nutrient intake, ratios of 24-hour recall to the weighed record, which is a gold standard. And then we did the same for Franny and the weighed records as well. So for the 24-hour equivalence testing, we found that energy fell within the 10% bound, and for other micronutrients, all other micronutrients fell within the 15% bound. Now, when we looked at micronutrients, we had 8 out of 11 fall within the 20% bound. 4 out of 11 fell between the 15% bound, and 3 out of 11 fell within the 10% bound, which wasn't bad at all for weighed records. Now, for Franny, we found that ratios for energy and protein intakes were within the 15% bound, and for fat within the 20% bound. Equivalence was determined for 7 out of 11 micronutrients at 20%, 4 out of 11 at 15%, and 2 out of 11 within the 10% bound. Next slide, please, Aula. We went ahead to look at concordance correlation coefficients, which tell us how close to the gold standard, the weighed record method, Franny and the 24-hour recall methods performed. And we found that the CCCs between Franny and weighed records ranged between 0.47 and 0.72 with a mean of 0.64. And these were higher than the CCCs recorded for the 24-hour recall, which ranged between 0.48 and 0.28 and had a mean of 0.48. So generally the trend looked like the CCCs were higher for Franny than for the 24-hour recall method. Next slide, please. And then we looked at sources of errors with Franny and the 24-hour recall. So omissions, the omission errors were those where foods were recorded by the weighed record method, but didn't show up on Franny. And intrusions were when foods showed up on Franny that were not in the weighed records. And for Franny, both omissions and intrusions were 11%. But for 24-hour recall, we had 11% intrusion and 26% omissions. Next slide, Aula. Right, so our study found that Franny and the 24-hour recall accurately estimate energy intake in adolescent girls. For Franny, equivalence was determined for 2 micronutrients at 10% bound, for 4 at 15, and 7 within the 20% bound. And for the 24-hour recall, equivalence was determined for 3 micronutrients at the 10% bound, 4 at the 15% bound, and 8 at the 20% bound. So Franny and the 24-hour recall performed quite similarly. CCCs were generally higher for Franny than the 24-hour recall, and Franny had lower intrusion and omission errors compared to the 24-hour recall. Next slide, please, Alan. Right, so Franny and the 24-hour recall in Ghana this time round were both more accurate than in the previous study that we had, and have come to par with Franny at Vietnam. And we attribute the improvements to improvements in the AI model, and also we've improved our food databases quite a bit. For further improvement, we're looking at expanding the list of foods for manual entries, and also take a closer look at the underestimation in portion size that we kind of are observing with Franny. So for next steps for Franny in Ghana, we're just about to start another validation study in youth aged 18 to 24 years. And then we also hope to have a pilot to monitor quality of school feeding programs, incorporating the Gdqs meal into the Franny dashboard. Next slide, Aula. Yep, so this analysis builds on work by the whole Nudging for Good team in the USA, in Vietnam, in Ghana. Yeah, and our study was founded by the World Food Programme. We'd like to thank Foundation Botna, CGIAR, and the many people who have contributed to the project. Thank you.
Great. Thanks so much, Gloria. So nice to get the update on the work that's been done in Ghana over the last few months with the Franny. Okay, so for the final presentation, I'm going to turn it now over to Arlene Mitchell. She's going to talk, as Alu mentioned, about the results from the Global School Meal Survey. Arlene, over to you.
Thank you, Linda. Give me a second to share my screen. And here we go. So I'm going to talk about our global survey of school meal programs briefly, give you some background on that, and then zero in on some of the key aspects that talk about quality and nutrition. So we have completed the second global survey of school meal programs, in which started in 2021, and the new report is just out. The survey, the first one was done in 2019 and covered basically school year 2018. This second survey covers the COVID year of school year 2020. The survey covers multiple aspects of large-scale school meal programs around the world. We ask national level questions and program-specific questions. The respondents to the survey are government-appointed focal points who gather the information from wherever in the country they need to gather it and submit it and give approval for GCNF to use the data in our database. The survey is funded in part by the US Department of Agriculture. There are full reports, and I'll talk about that in a second, available on our website, and you can ask for access to the full database if it's desired at info@gcnf.org. So the two surveys combined covered 154 countries, many of them, but not all of them overlapping. And the second survey covered approximately 81% of the world's population when we calculated over the countries that responded. The reports that are available, there are two global reports, one from the 2021 survey, one from the 2019 survey. There's also an executive summary in multiple languages and a number of social media tools and infographics available on the website. Each country that submitted a survey has a summary report. We call it a country report. It has normally 3 pages, depending on how many programs are active in the country. The first page covers everything from national level policies and laws that pertain to school feeding, budgetary information, what food is used, where the food comes from, complementary activities, and coverage information. The second page covers a section on nutrition, on agriculture, employment, and community participation, and a number of other aspects. And then each country report has a summary of each active large-scale school meal program in the country. In terms of meal quality and nutrition, there are a number of questions that relate directly to it. I just pulled some of the more obvious ones for this slide. So the survey covers the topics listed on the left. And then I've noted whether they are relevant to meal quality and or to nutrition. So now I'll give you some highlights from that we've pulled from the 2021 survey relevant to this discussion. 72% of countries said that they have national laws, policies, or standards related to school feeding on nutrition in particular. And we know well that having policies or standards don't necessarily translate to action, but it's still a very big step. In terms of program objectives, 93% of programs reported having an objective to meet nutrition and or health goals. We note that only 35% of programs reported an explicit goal to prevent or mitigate overweight and obesity, however. We ask about what food and beverage items are allowed in the program or used normally in the program. And this is the list. I note it doesn't match exactly with some of the lists that you all have used. And I think it would be great if we can harmonize a bit more how we categorize food items that we're examining in school meal programs. So in terms of diversity of food basket, the upper part of this scale shows by region, and we did a little bit of creative jigging of regions to give similar kinds of statistic capacity. But food basket diversity is listed here in terms of how many food items are included in the food basket that they reported. So the total, if we take out sugar and salt from the number of categories, that the total categories available to be considered are 12. And you can see at the upper part, the regional breakdown of how that plays out, and the lower part by economic status of the country. To pull out a couple of kind of stunning facts from this, low-income settings reported only like 23% of programs reported using fruits in their school meal program, whereas almost 100% of high-income countries reported, programs in high-income countries reported using fruits. Similar breakdown when we discuss poultry. In beverages, we ask about both sweetened and unsweetened, and the results of that are below. We asked about fortification, biofortification, and micronutrient supplements, and we have a substantial amount of information there. 51% of programs overall said that they use serve fortified foods. Very few, and almost all of them in low-income countries, serve biofortified foods. And roughly 16% of programs give micronutrient supplements. And I think the 5 most common fortificants are pretty obvious: vitamin A, iodine, iron. We ask about training of cooks and caterers for school meal programs, and the responses are here in terms of most get some kind of training in food safety and hygiene, fewer in nutrition, even fewer in menu planning and portion measurements, and very few get any training at all in business management areas. And when we talk about quality in particular, but also nutrition, I think there are a couple of issues that I want to highlight before I finish up today. One is that the cooks and caterers in school meal programs are overwhelmingly women. 82% of the program said that at least 75% of their cooks are women. But at least a third said they don't pay their cooks. And even in cases where cooks are paid, many of them are paid in kind or via community participants' parents, et cetera, which is a little bit difficult to track. It was very clear that the more women cooks were involved in a program, the fewer were paid. The last point I want to make before closing is that infrastructure has a great deal of importance to meal quality also, and we find dramatic differences between regions and particularly between economic groupings of countries in terms of how much infrastructure is available at the school level. So this is just a snapshot of what we've pulled from our survey that might be relevant to the discussion today, and it's all at a much more macro level. We are very interested in learning more and working more with others because there's a lot to yet be done about meal quality and nutrition in school meal programs. So thank you very much.
Great. Thanks so much, Arlene. A nice way to kind of wrap the session up and bring together kind of the work that's been done now on indicators back into the programs and some of the information that we know about what's happening in different countries across the world. Really valuable to have that information coming in. If anyone has any questions for the speakers, as I mentioned earlier, you can put it in the Q&A. I saw that there was a question earlier for Winnie, but Winnie, I think you've already answered that online. There's a question now for Gloria. Can you also provide, let's see, question mark. Do you also provide the fortified food in the food lists? So maybe over to you, Gloria, and or to Alo for that one.
I'll take it. The question says, do you also provide the fortified food in the food list? I'm not sure I know which fortified food exactly, but no.
I think if I'm correct, I think the question is around whether fortified foods are actually included in the food list, kind of, right? So is it cereals, or is there the option of reporting that those are fortified cereals?
All right, so we have a list of commonly consumed foods, which we have worked into the background of Franny. So participants are at liberty to, when Franny does recognize the food, then they just, that's it. But when Franny does not recognize the food, they have the option of manually entering some of the foods. So the food has to be on our database, actually. Yeah, so it's specific foods that we have put into the app.
Right.
Alo, did I answer the question?
Alo, do you want to come in, or?
Oh yeah, for sure. Gloria did a great job, and I think it's a really interesting discussion we've been having with program implementers who are really keen to capture the incredible contribution fortified foods can make. The challenge, there's a couple of challenges, right, to do that, because you don't really know to what degree each food is really fortified. You have, some countries where they mandate fortification, so we can really sort of make sure that the ingredients that, our app recognizes are tied up to a food composition table that then sort of reflects that element of mass fortification, for example. Iodized salt is a good example, right? But there's other products that are very hard to integrate because essentially they look the same, and Franny really relies on look, right? So if the eye can see it, Franny can see it. But if the eye can't tell the difference, and it's the classical problem with fortified foods. One way we're trying to do it is where there are specific differences that can be visualized. So like orange fleshy potato, where, it's a specific commodity that some programs are trying to push. And what Gloria didn't talk about was the sort of the nudging gamification functionality of Franny, which is sort of built on the USDA MyPlate app, which allows people to set daily goals. And there we have the ability to nudge by letting people know, look, consume an orange fleshy potato a day, for example. And then we're able to sort of relate that back when we track the food. But that's really an important, very important question, and an area where we hope to sort of, expand the work in the future.
Great, thanks, Alu, and thanks, Gloria. That is a really comprehensive answer there. Did anybody else want to come in around fortified foods, or I think the previous question also was about animal source foods and how that gets classified as a healthy food or an unhealthy food. Anyone want to come in? And otherwise, I'll move to the next question that's on the Q&A. No? Yes? Okay. Then the next question is also for Franny. So Gloria, for you and Alo, will the subsequent next steps look into the costing element of using AI compared to in-person monitoring and measurements? Or are you already doing that maybe? Go ahead.
Yeah, it's in the pipeline to take that as well.
And if I can maybe add, what we tried to do is really build on some really nice work that Winnie's been doing, sort of comparing, costs of different methods. And, some data we've analyzed already just will give you a sense of the reduced transaction costs of this new technology. So for example, a 24-hour recall, just in terms of opportunity cost, so time it takes for somebody to go through a recall is about 30 minutes. That's roughly what it takes on average in our study. If we compare that to the time it takes Franny to recognize and log, so on average we have about 20 meals per day, I think, between 15 and 20, I think, per day, and it takes a maximum of 10 seconds per record. So we kind of get, in 100 seconds, you can get all the information you need to make that recall. So the opportunity cost is a lot lower. The 24-hour recall evidence suggests there's about $100 per recall. That's roughly what the order of magnitude. With Franny, you're expecting that to be just the cost of sending data over the internet. So really, that's a huge saving that you would be able to make. And we're kind of showing that they're equivalent in terms of performance. So the cost effectiveness is really a very big driver for why we're doing this work.
Great, thanks, Alu. I don't see any other questions there. I just wanted to, until we maybe have a couple more that come into the Q&A, I wondered if maybe you and Gloria could also talk a little bit about what you found in terms of the government's reception of the use of Franny to collect this information.
Okay, so we spoke to the Ghana school feeding program bosses, and they were quite amazed, at what Franny could do. We actually took Franny along to the meeting and had some lunch, and they got to use it to recognize the foods they were eating. And I think they were very impressed that a tool like that could be used to monitor what was going on in the field, at a much lower cost to them, because monitoring is a high costs, line on their budget. So they were very interested. So hopefully we can take it further with the Ghana School Feeding Program.
Great, super, thanks. I think there might be another Q&A in the group. Winnie, this one is for you. Is there a significant difference in terms of results for the GDQS meal, I suspect GDQS meal, between rural and urban settings?
Yeah, great question. And apologies if this didn't come across clearly in my presentation, but we're at this stage right now of developing the metrics. So we haven't yet had the opportunity to fully test this and run, different studies in various countries. But this is something that's planned for 2023. So hopefully the next time we all meet and discuss, I'll have some results and be able to share those with you.
Sorry, I was muted. We have about 5 minutes left to go. I'm just checking again to see if there's any other questions that anyone wanted to raise. In the meantime, Alu, Arlene, Gloria, Winnie, did anyone want to make a few just final comments, a few thoughts kind of also on direction? Over to any of you.
I'll hop in. Thank you, Linda. Really excited about these opportunities to share information through the School Meals Coalition. And also we'll be talking about Franny, I think in Benin, right? Alo, we have a Global Child Nutrition Forum coming up from October 24th to 27th in Benin. And I believe you're talking about expanding Franny into other countries, including Benin, which is very interesting. The other thing I will mention is that we will be doing a third round of the global survey in 2024, and we are hoping to build an ability to look at changes in school meal programs as they evolve over time, which will be really exciting. That's it for me. I really appreciate being part of this discussion. Thank you.
Great, thanks so much, Arlene. Always great to have your inputs on this. Alu, any final any thoughts from your side before we close?
Thank you for the plug, Arlene. So we are really looking forward to being in Benin and really sharing, these findings with the whole GCNF sort of audience, and really the opportunity to really try and make this technology relevant to programs is so obvious. So, we are hoping to also take the Ghana pilot to the next step, where we actually have a specific version of Franny for the school meal that kids can actually use to monitor the program in real time, and possibly use the new indicator Winnie was developing as a way to sort of provide immediate feedback that programmers can then sort of act on. I think that's really what's driving our interest in reaching out to this audience. So thanks again, Arlene, for having us there.
Great, super. And Winnie, Gloria, any comments at the end before I wrap it up?
For
Please,
me,
Gloria.
I'd just like to say that I'm really happy to be here and to network more and to see how we can work together, and put the little pieces together to form a more comprehensive picture. So yeah, I'm happy to be here.
Super, great.
Thanks.
Winnie, anything from you? I see you going off mute. Go ahead.
There's not too much to add to these previous three excellent comments from Arlene, Aldo, and Gloria, and completely agree. Just happy to be part of this network. And if there is interest in learning more about the GDQs meal and menu metrics, and interest in adopting at some point as we ready them for testing or just further discussion, we would welcome that, and look forward to working with everyone in some capacity in the future. So thank you.
Great. Okay. Thanks a lot, Winnie. And thanks to all of you. Again, really exciting to see the work that's happening. And also, I think as Gloria mentioned and everyone, it's really just exciting to see over the last few months how the different actors across, our organizations have come together to really start to think about these questions together, as opposed to kind of in our own little silos and work. And I think, there's so much opportunity, so much need. And so working together is really just an excellent way to do it. And I know that Marie Ruel always says something, and I can't repeat it because I can't remember, but there's something about the fact that without data, you really can't do much. And so I think, this is just really an important initiative to be able to better understand the diets of this age group, and then be able to use that to make programs stronger. And so I know it's kind of long. I think there's been many discussions and there's been a lot of work building up to this, but it's so exciting to see that now we really are moving towards, tools and methods and approaches to being able to capture this information in this age range, and hopefully being able to then really have a positive impact on diets and on nutrition outcomes in the very near future. Very good. Thanks so much, everyone, for joining us. Really happy to have this opportunity. And as everyone has mentioned, the different speakers are very interested and very willing to follow up on with more specific information on what they're doing. So thanks everyone. Have a very nice evening or afternoon,
Thank
depending on where
you.
you are. Thanks.